aba eba my health my life mapomuden eneme nkwaso medin di Abigail Ashley na mejidi so sorry anopai wadanya me ase sister brother mame papa me pa cho unda nya me ase e dia nyina ye fasema ba akopɛ na ye nkata yeni na ye nkasa erade ye da ase sasa mwede hu hia me nti na de bia mesremo se munyema me no nti adanya me ase die na edi dwumedie no e ba be hyehye so ano no ana onim se busumi July ending bia se July ebe ni wieye no ye de esi ho se eye World Hepatitis Day ai enne ye be bon komo afa hepatitis ho de nti a e wo se e bo ho komo se de ye be ya ye be si ano ankoranko ana onim se hepatitis nso e affect with liver ana eno nkomo ena ebebo na momansa na ebe start yen nkomo bono ma me fa se da kese pa ema abutre clinic doctor ne pamfo ye da mase omaso ensem na edijumede yi ebremo abutre clinic omo ye ba no pressure mo amepacho omo no mususo wunsem wona ase just omo find point ewo wunsem ene wona ase ene de sayare omo ma wedro na se omo mususo so wunsem a omo be hu bebe ayare ne hye na omo asa ama doctor amano ne nkrofo ye da mase Ghana nso da mase sanso na edi ase da kese pa ema yam vita ye cereal ye de mankwala na nso penifo ani je ho pa pepacho your rice your wheat your maize dia ope bia your sachet your can dia ope bia wa ho odin bedu bia utumito uko supermarket uko jombe bia yam vita awo ho to be mankwala no why na ye emamu sanso na edi asedanso ma procode oral care pepacho utie se pa kakra na se wonu ho ye onofo a onya o procode ni bia dia kojakfo aye na wa afa bi pache edi na nsa na enkoya na ko hu doctor Nensa hoyare oboso so yase na edijumede ibram sanso na mede aseda kese pa ema special ice mineral water yes water is life ubenu munsuo nso a no munsuo krogen nsuo papa nsuo beba ho ban eno na special ice mineral water na kai se yesi ne pedua na ye wo no 60% of the moja na we yemu no eye nsuo enti ebra wonu munsuo no na chese moja na sorte enti make sure se ubenu munsuo na waba ho ban yentwa ho sima ye koba ede djumade no ba hye so aba ena e kasa for hepatitis yenkombra I must say my train and my try on waba. Kai say jumede ye di DSTV channel 360. Ye was so Samsung na YouTube social media is na Facebook, YouTube, Instagram, X bebia ye da honomo and a share. And let me see a bon komo afa hepatitis ho. Kai say busumi July ending bia ye di si ho say yem bon hu dewro na manfo nte no muhu say ya really say hu say nye hu say ku say nku eno hu nyina ye bebo nkomo e wadwumedie so na ye koye yakotunsa afre Dr. Fatima Mohammed or a physician specialist or science ye gastroenterology fellow in training ai e baby science and also e den ya because hu nya ye e din kakraka gastroenterology fellow in training eno eden and as so na yenua bema Richard Peter Yali and so or a senior nursing officer as a public health for West Municipal Health Directorate on also studio ha yenua baba bonko afa hepatitis say who say you say ku then pint na did the whole July is your saying bon dero and no nkomo and e baba bo e wadwumedie no so mama kwaba bibi aboko de me pacho sa gastroenterology no fellow no ni na aka ho gastroenterology fellow in training
ni na aka
aseche say
trese doctors a omohwe yefuni neo ekeka ho nyina
enye yefuni so inside oh okay yes. Enter there's a more enter
no ena ne ekeka ho nyina
okay
the liver ne pancreas
okay
sa neme na ewo yefuni mi nyina
wo de no eno sa no pai nipa no yemu na okohwe ana de den ne kohwe
eno yetie ne nipa no e de by patient ne complaints ena e de hwe
okay
and sometimes and so your baby I friend endoscopy and no empire but we pass it through your mouth
then show enum as a tube as a camera be adi row enum
exactly
na mo de ahwe enti mu na mo ye gastroenterology for no enti wo wi a se se wo ye fellow enti wo wi a obe gastroenterologist public health for ejuma na ekoyie de yes public health for mo share office o mo mpi ampa Mukofield
ye chin papa
sa
ye nanti wi aso papa dan kam ye kokoo
public health that why tuntum but me who me feel hoda
sa
enti mo kwan fa
e depend brono a wote so
adanya brono ni na so na mo
gan west enti me di ma grow na
ga west ye hifa ni fa
man mpatemu
ene se o sanka odum ho
ablekuma
ene se o sanka odum ba me hu da
wote me ho
ai
ene me hwehwe
me hu
hoda ba hoda but we nim say ye
wa ai be no ba na o she overall
my share my uniform enti na
mo say me hu ye anyway busa for na ba be kan hepatitis so yes July 28th World Hepatitis Day. Na de bia me ya say ye twen saa de ni do a ansa na ye ka ade no ye bon de ro ade say ye ne sa I think that the whole year young bon de ro say malaria say want malaria de ro ko say to malaria dro nti wo ti say o malaria da so ho but hepatitis young bon de ro ye be twen saa July 28th kwakodo na ansa na ye bon de ro ade public health for
yo e de nche be ma etiefo ni ani ahwefo nyina ni etene say af de bia ye especially when you come to your OPD near adena outpatient department no ye nya kwanya say ye community there ba na ene oman community for no so e kasa ye bo ho dawro but ne ema eye sonkon wo 28 de no ene say eye da ye discover yare no
okay
nti no na ma ye siso ye yire ye ho say ye beka ho asama mankofo aso etuetue because on the normal day no say you can want some who ni say you can baby na for my dream crown obo yatida the can say yatida but e dan do so na say you can want some and 28 no so na you can want some and no ye dey fapem ye dey si ho fa afe no you can want some afe nipadodo a omwa yade no yetumi tweba na ya kan wasem se na be obi a betimi ehu se yare no ewo ho nye se ye boy etim na yaka ntabi bia from January to December no uba ya yare sabia hodo ni nyina e ya ade a ye hamaso ye boso saa ye ko community no so e di ho djuma abi bia ye immunization activity ni ade bia no ye de ka ho e bo ho dawro but esan se enye eno wa enye danon so ye ntina sa woka anya no na ye enye no na ye tie we nti sa dan du sa na anabosome na ye di hepatitis no wo mu no du a ye bo ho de wo fiti first na ko se be di ewie twem na ego so ye de ato aso e bo ho de wo
Dr. Fatima Muhammad me pacho omo nte hepatitis da omo ti say ya kan so mo nche dan say da no ye ka say hepatitis e de ya
okay nti hepatitis ye inflammation of liver brebo
me pacho bubu ma ye inflammation na such as
inflammation nature say ebia na brebo na atochi makakra ena aswele aswa kakra nti inflammation
okay
nti inflammation nature say bibi na cause inflammation no nti e ka hepatitis in the broad term e say brebo na but there are so many causes ye onyema bebre a etimidi hepatitis emanipa eba nti what we are hammering on 28th no ye viral hepatitis apart from virus no ye wo toxic substances a etimema
ombrebo no so
ombrebo no ase ye now so ye wo drugs nso a ema liver no problems but ne wo say ye can 28th July ne viral hepatitis nti a ye hama viral hepatitis ne say back in Africa no viral hepatitis is our major cause of liver disease.
To say viral hepatitis, not just say virus na deba.
Virus na deba.
Virus na fi fa na eba.
Nti eno ye beka ho asem. Ha nti viral hepatitis na ye ka ho asem na etimema brebo ne se etimema liver cancer ne sa ne manema ne nyina no eye 2. Viral hepatitis B and viral hepatitis C.
Okay.
So hepatitis B virus and hepatitis C virus. And no emma ibrebo no nso akeke. Emma yare fufo etimi dane eko cancer, eko ne friend liver cirrhosis. Ase brebo na hohunu na afede
abompompo.
Aha, ne ma sesa wo ma entimi nye djuma bio. Aha, nti na ye bo hu deru no. Se ne be ya nipa bebrebe hu ne edeba and how to prevent it.
Nti ye bo the viral hepatitis no hu deru ne ro. Na viral hepatitis na me bisa se a virus na efri hefa na ewura ye mu kokko sesa we no.
Okay. Nti for hepatitis B and C no say na etime affecting nipa no is the same, almost the same way. It's just a little differences na wom. Nti both of them mame timi di maneba.
Obata timi di maneba.
Obata so owa nti ye advocate say obi a onyimbia e was so antenatal clinic na yen check viral hepatitis status. Say na be ya we can take measures to prevent say akolano and and another thing too is that moja
dog mean chowa no so maame no nya free fa na ode ma akolano.
Okay. Nti maame no so betimi enye free moja transfer of blood.
Oh, okay.
Nti ye ma moja yen shedan hwehwe mu enhwe say viral hepatitis B and C wo mu a ebetimi account. And exchange of sharp objects and so. Nti nail clippers pedicure na yen hwe ho. We are not careful about those things no. Nti exchange of blood betimi abemu. And exchange of sexual fluids, especially for hepatitis B na kasa. For hepatitis C no ebetimi abanasa, but the risk is low as compared to hepatitis B no. Nti sexual contact, sharp objects, blood transfusion, and oba time so ebetimi edema. Those are some of the things.
And not just say transmission is through blood. Or not
blood or fluid.
And then you moja nkwa about like sweat in your mouth.
Okay. So Yebeka wants and because nipa bebre stigmatize patients with hepatitis B and C and yes the only bodily fluid that can transmit hepatitis B is by sexual intercourse. Apart from that, say obi sweat account, say obi ahageo, just sharing food items and spoons with people, and for hepatitis B.
Doc, say that what can I say who to say HIV/AIDS, my boy.
Okay, meet me aka say yes, it's in the same range, the same direction. Nti even now we are moving towards what we call the triple elimination. The hepatitis B, aka HIV, and syphilis to eliminate because they all have the same mode of transmission. They all have the same way of affecting somebody lifelong. Nti say any HIV kwa na yebo ho dewo ye the hepatitis B and syphilis aka ho aye triple elimination target.
Wow. Now doc B ni C no the one pa na ye common Ghana.
Nti hepatitis B more common.
B no.
Yes, and the reason is because hepatitis C no uhun in tema it's curable. And
C no.
Yes. You bet me ama we draw 3 months, 12 weeks and I san check bi na edro no is about 90% or higher effective a bit me a clear virus na any mobile and ultimate transmitted bio. However, hepatitis B no is difficult to clear because abuano or call system one kosha DNA mu.
Wow. Yes, and say fi moja ninti.
Nti call moja ni ma na kosha DNA mu. Nti it's difficult to eliminate totally from somebody. Nti enro na yedema microphone na more hepatitis B no it only suppresses a lower virus no send be a affected breadbone no emfa a how embryo but if you don't check your viral load you can still transmit it because viral load no cosura then the risk of transmission also goes up.
And the way they say it's HIV, because HIV so viral load cosura the risk of transmission also.
Yes,
it's a public health for mumbo rosa.
And tin or casa say a movie to triple elimination. I say or babia when you more about Ayasabiano. You better check HIV, you better check syphilis. They check hepatitis B compose you.
Where or more munyum, no more munyum. Your dogs so more munyum. And see,
you can only get the information at the community and in the OPD.
It's one about
you're born with the rule, a business of my acquire about radio station. A acquire first one, a man called Fuati, sign your millionaire. I told the beer, your per medium crown and your call for Cassa, a year de Maye.
And I say, this is your radio station, yes, Yaka. I'm power. Also, me buy me adverts. Monk of 8 young and so bar. I was up here. Now, put the room number. What I say, and you free. You see, I'm a boy. Or be hospital, which is it's Muslim bar. I was a bit here.
But when Abibiano in our hospital setup, hey, you share, don't be brave. A big corner be by to say you develop be a friend to say TV or what near the audio nashim, nay a bo, nay a can one say
Richard, may I read mobile hospital? I just said,
education, and I'm a picking in premier and say, but I some like know, and then I'll bet me I can't find, and you get the result to say, one share.
Because yeah, me na me to hospital and you feel na be TV and na public announcement.
And local community ni so na empathy abem. O from so ombra mo be show na nka ye ntwetwe ho nkomo o nipa mi no.
O fra na ka wato so bolo bi esio.
And no na be twa ma ba na no so no sika no. Sika na de be say adwuma no. Another problem. Interma de rubo no ye boss so ampa but the was say a person could do no and do Emma nipa bebre na obu obaba ya sabia obohu no na aye too late if you say ya dey bobosi esenchene no who say because esenchene boboso no who say ni na wo yare bia obetimi nya sa esenchene na bi ntema wa adwimpo enkoso say ye no na how into baba be ya pomede ho na afedie
ajinsem Dr. Fatima me pacho who say ye won kwala na obi bejo ba na ofefe akwala na no man kids say saden eboa eye
Mecca say emboa and the reason is not because of hepatitis B and C but other viruses were where obetimi a transmit ama oba anti eno emboa because omo no muswa omo immune system ne etimi ma omo fight diseases no enye strong sa nti o tie sa na obetimi e de how abra
kwala no ebusiafo and ma me try ho esikrom na ebisa manfo say hepatitis aye ken omo nim kofare bayana men kwoti enkofo enu say ba be share the signs and symptoms no both the hepatitis B and hepatitis C no ye be share signs no nsenchene yi ni ho edi a obehu se owo bi ana woni bi e we se otu ho anamo ana ni se wontu ho no ho enkotwe ho nkombra sisia
Kakra fa hepatitis B say yawe a ekutia ya brebo na kakra me ni say you want types ahodo bebre you A B C kura ho na B ni you say very very stronger so one ya hweye na mo bi kan wa na one ti na treat ni yesu a obi ti yaku na ni ma de ba no doso so ni pa no eni hia no wo bia na mo ja nya stronger obi ti manya
Widia yesu so saa etumi ebe saa yawe no etumi de brew na unu ebidi ikekahudie so a ebetumi so de ala eni na nimfa saa yawe no unu ebidi ebi amu have sex a ebetumi de saa yawe no ebe aba ena nimfa ya ebetumi abon ho ban no bi ti se aduane na asai na yedua yebenya no se aduane na yenni kwa se yetumi make sure se yebe hit no na efie so ni efie bia na se ye fire dem no efie so we se efie a ni ebeboa wa na wa fano na bi ti se amu no mo nsa no so ni mo nsa so we se etumi deba nti se no so yetumi hwese ye begya nsa no ennom eno so betumi aboanya yentumi nya saa yare no
it is be yare bia eka brebo and a viral infection nti the minimfa hepatitis B no and as enya won so a because aka brebo nti no the effective brain never one o look rana the color ni change and my feeling nauseous as a buffon or befe and my fatigue and channel bread and near my beer a hepatitis B no I think say so so ni pino no I think say a adherence a sign a viral infection it is a will be na bia o use facility bi na say hunsuo ni bi kura ka ma obenya and e nya bi nso friend dem obi o wo bi no one ne partner so shia otiminya hepatitis B ni bi and as well na ama o immune system no so aye weak weak immune system nti yare awodo be break otiminya jaundice o skin no color no kura timi ba yellow ni ade ti di menimfa hepatitis B no it true and say hepatitis B no essay ya brebo
na de say
bidebi enye esin kwani nya no wondem nya hepatitis B so free and them on protect yeah so obi a owo bi ene obi a onni bi koshia betimi enya obi a owo bi enso timi use me mfa say washroom bi na obi a minya bi no because use washroom na the possibilities that metimi enya bi no so you very very high. Even will be kura, I think it's sweat kura no, you can get it through sweat. Nti ya fa passenger car na say ya car kura na say bibia will be ana. Yeah, very very careful.
Yo, Mr. Martin try me nimfa hepatitis ni say. So obi wensi na say we gina ho a e ma wonya bi. 2 wokọ washroom na say obi dun so a e we say wo flash ansa na why the was one dun so one flash na say wo kotena so a e ma wonya sa yare ni bi e na kere to no so ni obi nam na say bi amfifiri ati nipa no na say nipa no ho kawa e ma wonya sa yare ni na afi so tere na to so tere no so say so bi was hepatitis ni bi na no ko di empemu agura e ma wonya sa infection ni bi enti no mi ameso me nyame badwon kira ameso me wo efa ho no enti me no esi ade America ne say so obi uko washroom na so obi uko washroom so make sure say o flash answer na why there what na so ana say wo tissue kra na ana say wiper for paper toilet no so answer na why there what na so say what na so yes na ma we nyina o nya sa infection ni bi se ni damase.
Busia for among for natural munum and I was so Unim hepatitis B and C de kofa eba ana unima question bia opese obisa bia nso so fabra na yemfa emfi honom no ye ko break na mesi ye ba ye be hwe the signs and symptoms de obehu nsenchene ebe yi ni hu edi se wenye bi ana wenye bi B de na etesen C de no so etesen.
Okay, nti signs and symptoms ne de doso, but ne meka ne say mostly hepatitis no eka wa untimi hu se ewo mu. Yes, majority of people no mo ye ne friend asymptomatic omo ni symptom bia
no symptom hwenyo
wo omo hu nti ube hu no na ase obrebo na ewie, but ubenya signs and symptoms na it is any other disease bia ewo ho nti fever na ohunam ye oya and some people are there, they may get vomiting but you may think that malaria nti echo sana in the acute phase no ebia na ejai nti hu se bibi eyo ana bibi ha obrebo, but over time, over years it's not going to show any sign or symptom for you to
no essentially.
Yes, until ube no na aye too late na ajinsem.
Hey, no essentially.
No,
but one ajinsem.
Na ajinsem, but start to say how brebo na there are other symptoms that you may experience. Until start to say affect your liver now, ube hu say hoya oya o right side no, o ye full right side no,
full right no,
ebet me aye oya. And some people get what we call jaundice.
Now, right okay, the hand we say, and so started say, oh
yeah, and then also a bit more. Now, omweni so aye yellow. A friend of jaundice.
Okay.
And almost skin. But blacks nanti skin ne de own time
who difference ni.
Ube who say when aye yellow.
Like no.
Yes.
Baby
fita no na adane color. And o Johnson so na aye dark brown or yellow. Yes. And some people too start to say cause liver cirrhosis na damage liver na yefuna kakraka ena omuna
so atata
ntisa
that is essence ncheni we de edu enim kra just asɛ nneɛma ewie kra so na obehu be start there sign bia.
But even when it gets to that stage no say oyefun kakraka na ona atata, yes, it's late, but then we can still make a difference because a virus no multiply, and once you treat it, it prevents liver na from developing into a cancer, which is more deadly. Inti enkase because we find kakaka and I say when you say yellow no Farmer hospital, you still have to come because there's something we can do about it.
But me also I just say there's still something I bet me I am. Let's just say who na dog ya na your body ro because say check blood pressure, check sugar level. I need sad didn't say ko check if anything hepatitis.
Yes.
Yet me check bibi sir.
Yes. And it's very easy to check. It's the same malaria test na. Oh. Rapid test no.
Okay.
We are advocating, so that's why we are here, that it is very easy to test your hepatitis B and C status. As for hepatitis C, is curable. And we can come and talk about it because when it affects you 50% of the time, ubenya chronic illness, not just a virus, as compared to hepatitis B now. Most people, 90% of Nipadian, clear infection. No?
Okay.
It's only the 10% sometimes they progress to chronic disease. And so if we are seeing about 3 million, we say about 3 million people in Ghana are living with chronic hepatitis B, then it means that much more people have been exposed to the virus because you say only 10% of those who progress to chronic infection. Not just say, maybe you and I have been exposed,
but we don't know.
You will never know. Yes. And it's those who present with the chronic disease that eventually end up at your hospitals and your clinics.
Because the beer on tissue the on hospital or bed and crash.
Exactly. But then for even those who don't progress, if you have your liver is still not damaged and say but you can still transmit it to somebody else. Yes. And that person may not be that lucky. They may progress very quickly based on some other factors. If you go and check and you have it, you have to advise your family members to also go and check. Send a bear, a beshe, a drono, as in them to prevent some complications. Now, mabubono. Yeah.
If you help us, so me who so open so do become.
No, what can I say? Baby, na be na aye late. And that time to say the can oba any just aye late in tent me your hwe. And e kwanya say e be so ano na yetimi abre virus no ano ase say na be ya enkonkofa hofofo mama famba. But baby na feel so aye late nti no e dey so be kwa akoye heba ana so omba kra ani hu ni kra bi.
Na your herbal is hepatitis.
That is what e be no mo GD say o dey akoye herbal edro. It will be no beka sabia do beka just so media me person ko ye bibido but I no so kwa fa another or how e dey abrebo nti ya e ka kire say ukwa ye say ni na obetimi anya nti no ma ye npo eduro no ya fa on to eduro no so na embo na ye hu result na mo sense nti ya de wo ho pa.
Dog, now I didn't say hepatitis and it's a liver no kwano peso odi hu agro.
Yes, inti about liver no dey because that is where it's very serious effects happen. But it may affect your kidneys and so.
Hepatitis.
Yes, or dialysis is so because of hepatitis B and C.
Oh.
Yes, it may damage kidneys and so. But more often affect the liver no. And that's where it gets its name from, hepatitis virus. A virus affected brebo. That's where it gets the name from. And it's because that is the organ that it most affects. But it may the name for it can affect your joints. It has other effects that it can do. But then liver no it was serious effects like it may damage liver no and function or a baby drone. Currently, we don't have any licensed herbal medication that treats hepatitis B or C. What we advise is that usually, even when you have chronic hepatitis, we say that you have to avoid even drugs that are prescribed in a hospital. No, so it's not every drug that is prescribed that is even safe for you. And then most of the herbal medications. Study the effect on the liver because liver no harmful part of endrona anti okonum herbal medication on top of your chronic hepatitis how fufro
Mami Bissau, how is Richard? Say obi person screening for hepatitis anything.
Oba ya share ya yo to say RDT test kits e wo ho a e be di kan apepa wonsan no na ya fa umoja no e de lancet no awo wonsan na wa na e de strip no e de afa moja no na e de de gusu no e de gusu aba ma ye ho mre kakra between 10 to 15 minutes na ya ready nti ye no yes na ya indicate wodin e wo strips no ho ti na da ho time so a ya hwe time so a na ya frel say bi wo mu a na afi ya ka che say ye hwe no edi kan no strip no indicate ma ba ko mienu
lines mienu as apem for the any be
okay to was lines mienu ni na draw red wo ma let's say
wo bi
but ye wie na say wo so line na ye ba ko pa let's say wo ni bi na no mponi aye wie na ye wo so line na ye mienu no afi ye be for sample ankasa na ya makwa ko liver function test na ya hwe
no be call lab ankasa ko
ya na ya hwe say na liver na ankasa eti and even the type na wenya no na
okay and the lab going to make sure the specific say A B and C
na fi etimi hu edura
na ono obetwe no hu say oni bi no no ye ndeng
ono obetwe no oni so oni bi no entempa na ye kire wo say vaccine wo ho for hepatitis B no.
Hepatitis your vaccine.
Hepatitis B no vaccine. Ebo ho ban for life.
For life?
Yes.
Oh, Ghana for.
No, sada na ye be kire wo say vaccine wo ho.
Oh, we have a vaccine for hepatitis B.
Yes.
Bebo ho ban afebo. And no from age ben na wo.
From 18 na ko. Ye won kwala de e na ye won penifo.
Nti kwala de no so afebo.
Nti kwala no ye wo ne na.
Ya wo ne bi. Nti odi 8 na wasan wo biom.
Odi ono so be wo abra ya wo no no. Ye wo na 6 weeks obesan ba beje de to so mienu. 10 weeks oba beje de to so miensa. Na 14 weeks wa the last one no so de nya e de ko
asa na for the rest of their life.
Yes.
It's honestly me tnas ma hepatitis affect here
na opinion nti na ye bo ho de wuro no because
if you have vaccine
yes
I think na yen wo
preventable nti na ma ye bo ho de wuro no nti no na ba sa from 18 years no ye wo enne bosomi na ba beje de to so mienu na 6 months time abeje de to so miensa na is the way we
and I'm penny for the no so sa.
I am penny for the no.
And so what there?
It is a wo tie me na so wa wo mienu a. And so ye. And so ba na ye hwe the status of your liver. Na ye check you. Na afi ya wo de e ka ho no. Na ye de aka ho ama.
Ebusia for me ma wo me de da. Ma wo bi. Me test ye. E bra me kwakwa surgery o mo test ye. Na me ni bi. Enti me wo vaccine. Ya. But at least first of all, test no boarding.
Test no, and then they say I go so you say be free. But over your government set up now. I buy it and she share but say intimate testimony. If you say
nkaka free,
you do. In fact, let me ask you, be an in your G.
The vaccine no make a
test no be an in your G.
Okay, private, okay.
Government private or no.
I already saw what cotton oil.
Over government side, and it be 5 Ghana cedis.
Obi abutu mi to data etina se yan krofo
5 Ghana na wetia wo opidu ho na ya te say check sugar level it's 5 Ghana na wetia na ya ma free na
we wa wan ko test ya obi be o say shop
and internet say no aban ne dey abase enya triple elimination especially for a man omo na omo nyem e na ombe wo nkwala
nti wa oba wan treat ya wa hwe na da koma wo
nti ne yes etumi ache wo mo ho
okay nti ye check ni 5 cd na ye check wie na wo bia woni bia vaccine no eno so ya he
vaccine de se ye ka sei ye individual ena eje
edeba enya aban
aban de bi buy for government workers na or health workers
enti mu da mu wo ye
de ye wo ye
enti akaye
nenti a oye sa na ni say we come into contact with
people a lot
so sharp objects needles and yes are there the be man
na omo awo
me no kan ni obi na wo ye
no kan ni obi
ebi suro enti ni obi na wo ye
next ni osuro pan ya wo so be obi pan ye
it's no so I idea one of the interventions or the buy so bia because ye any patients no ye come mo jemu ye come veins mu nte no de o bia kwan so bia no wontua obewo no na afi public no eno na ho ne ye problem ye advocate say nka embe kan ye routine vaccination no embe kan wo na nye free because eno no nkofo na krakra ndro no edeba nto odeba na so wo ye health worker na so wo ho mara akwakofa bia begu vaccine fridge mu na ono so e de won krofo e de won na waje kakra no eno so kra no ma price no enye one because obia ne ne auto ne de bije 45 bije 50 bije 100 the whole lot into say nya
kra se bebo ho ba have
but think ya pese aban no efa no de kan ye immunization structure no ho te say the HPV no aba ka ho ama ma no yetime fa no so kan wona nka obia hia bia no yetime awo bi a ontua bibia eno no be boa he na afi ama obia ye protected na transmission no so aba form na wo bia wo de duro so no wo so wa achieve viral load suppression na wentimi afa ma obi fofo
wow na me bisa o se ye di obom wo duro no dia forever
forever.
Na che say na omo nie bi o check obi a wanye bi no ono so na eduro no ne board na e free
eduro no omo wanye bi ne de eduro no so enhye da enya available te say
eduro no so enhye da enya available
se na nyame adom se de betumi aka say nyame adom aban afa ama yenya subsidy first na nka na boarding nti wesa na okasa nimpa no nkota na onwimi na okasa eto de bia na ya health workers ya kaka ensa se na de abo nimpa no ato e bia be 2 months de no ono ba se no ya abaya ma eduro na aba ama no bo akofom aba be 76 Ghana cedi enye free from 350 to 76 Ghana.
Okay, na 350 a month. Okay, but say 76 Ghana cedis. I just say what so. And so enye free.
So ko be na so be to amount 350 e be pa cho.
E be na private.
This
is all government
yeah. So omumbra aban ayare sabia teaching hospitals, Kolebu, Cat, all the hospitals what Ghana.
Na no sa na edro no be fa Afebo na for some time.
Afebo.
Okay.
Afebo.
Especially hepatitis B.
Yes. Nti ye ka se eno no e kwhye o DNA mu nti. Wan fa na afebo na ujaya virus no betimi asa.
Obesa Kenya
resistance.
But the thing too is that oka say hepatitis B edro no tenofovir no.
Yeah.
Say you are subsidizing pa. But we are still advocating say ye be na free like HIV medication.
Okay.
Say be obia benya access to it. But hepatitis C no free. Because there's a partnership
hepatitis C.
Yes, between Ghana government and some other
Ghana
countries.
As C no
free.
But B no na aban afakadi from 350 say 76 Ghana cedis.
And a C no so ni boy ding papa ni boy ding ye. It's in millions of cities. Nti abe free ni die. Everybody should take advantage of it. In all teaching hospitals, all regional hospitals, and some selected district hospitals. They will give it to you for free.
No, okay.
For 3 months. Yeah.
It was for the questions be about, but me per se try and hon kwaje crack so free abo for her. Ye bet you ankomo no so. Nkomo no de e ya desuade pa ene hu hia nzimpacho fra unua no so on betena se na ye wie akakra be wie. Ye try and hon kombra sisia. Avoid as well share my health, my life, my pomodin and menkwa ewa United Television. So medin the Abigail Ashley and minute Dr. Fatima Mohammed, a physician specialist or sound so ye gastroenterology fellow in training. Aha, sound so na Master Richard Peter Yali ewa hanmo senior nursing officer or sounds so public health West Municipal Health Directorate. Minimum enable komo afa hepatitis ho and hepatitis A kasafa hepatitis B and hepatitis C ho and no komo na yebo it say July 28th a World Hepatitis Day nti ebode ro no na ma yamamo atiase say hepatitis eda so any Ghana for ho nti wan hwe hu so ye dia na ebanso so dia say edro ho na woni bi nso say vaccine ho a ubewo abo ho ban afebo nti pacho won say ya catch your bohu de wura ni dog ye share some of the complications no eto de bia o kayare no na wan bo complications na omo fa no fala ba obo complication afa na nipa atena sie na wa hye ne ho de nti pacho some of the complications hepatitis B and C complications be na nipa ne benya so nya no wa when fi no jeja no ho sa e den na beto nipa no
nti hepatitis B or C na chronic nature say system no anti-me and clear virus no nti she omu e betimi ase wo liver so the first thing is that e betimi ama liver no enye dwuma yi na liver no ne tissue no are replacing with scar ase wenya kro nti sa scar tissue no nti menye edwuma na liver no ankasa ye no nti na liver no toxins na e wo say you free mu no proteins na e wo say ema o nipadwem ni nyina entimenye nti e friend liver cirrhosis nti eno no e ba ne sa na won say na nipa no ne yefu aye kakraka ena ne swate wa form because proteins na e wo say the body ni produce na etimema moja nso too because liver na ema onya ekro onya injury etimi stop bleeding no nti e find the clotting factors unni bia moja timi too and at the same cirrhosis na ebetimi ama wa fe moja
obefe moja
yes
wow
and also toilet na moja bebre ewum nti that is for the cirrhosis and beyond the cirrhosis no we can still prevent it from becoming worse nti enkasa we nya liver cirrhosis nti enwa no nti unya liver cirrhosis na we can still treat the hepatitis
we na nkrofonya no mutifie musu nkrofa tu omedro
no it's not true because no hepatitis
B
no na edeba so you see that even at the cirrhosis stage no odeba hospital na ema wendro na it can solve some of those problems semoja na etu no ebetimi a check a solve that problem no. And then if you don't do anything about cirrhosis no and also bet me progress to liver cancer
from and cirrhosis to
cancer it's very very deadly because liver cancer no survival rate no enye nti empese bedru ho unfortunately so young people affected yes because obi wo ho a ebia ne mame passe virus no down to them during birth until over several years no over 30 and 40 when you juma wa ware foforo no na afi na cancer no show on the head until we see a lot of young people and to say other cancers are affecting older people hepatitis B especially here because of about time to make the man bananti it affects more of the younger population and pese bedru ho
so
yes and maybe transfusions and sharp objects and razors blades and exchanging those things some people too circumcision no a certified hospital sterilizer equipment trained it can transmit that. Obi nso ho yare ana omo na ko baby heba na the same instruments are used for other people. Nti ni nyina timidepa. So we don't want to see these complications because say obi hu say ababa wa we si so ana say be ma we si so then you are coming in with cancer. It's sad.
Dog, hepatitis in a
yes.
And they will say about the rule.
They'll say about the rule.
May am ambassador why? I didn't hear too much. It was over my questions so my church member says herbal medicine can completely cure hepatitis. So there is no need to go to the hospital. I think also we need to say hepatitis no you bet to me the bibidro asa inte hu hia se obekọ hospital na obisa se yampa na
na medi kan no yenya so bia ekire se yenya bibidro we eka ne pa wenya hepatitis na ebekọ until say ye be hwehwemu na etimi approve say edro we ye de kan nimpa wanya hepatitis no na ya te say covid by ye vaccine no within that shortest time confirm avail omo
okay
dey trial nti bibidro for no so ye nye obi na okasa obey trial obi a wenye be ombra na nipa ko no be agya tu
na no me nu e bi kasa mo si trial na the board nti na almost so energy dodge but they believe say they have they believe they have
yeah the science na be
okay
nti na my fapem say ye draw we and a draw we and a dosage we and a one ma hepatitis and one na wo mu no ebe confirm and ebe ko and asie betu yenya no yentimi kan wasem say
exactly
ye dey be draw
no Richard no obviously someone in my family has hepatitis and everyone is trying to avoid the person because they say it can easily catch up with one another and see are we treating the person unfairly obisa also be wo mubusemu a when you hepatitis ni bi na so be ponipa no afedo onu say bisa say de omo ye na ya na
de omo ye ne nye meka say de omo ye ne nye if you say uchia na unya hepatitis ni bi
sa
wona ne da mpa ba akoso a unya hepatitis
no chance ya me didi odibedidi
chance na odidi mu no woni na betumi atun se kra didi unya hepatitis ni bi fapema ema ebi otumi nya hepatitis yare ni bi no eye moja jisa wotwa wo ho
na me de hu se kro we nenum so didi odi be hye nenum no asa de start
o de nse na edi aduane no ko na no fa ne say na anko ni na enchire okay pano eba sa mama ye yi nipa na etotwene na ode adwendwe mum apa ho but onu wo na nya yare na eku no eye busua no pama o ma pama no abre we na e wo se yetime kan nipa no efua yetime hage no yetime mede no ema ne ti eto ya beti na ye krokro no na ye jeje no so kakra na ema ne ti me na de do akofa yare aba na nso ye ma na awem hyemu se edro ho nte no ho be den ebeto no
mama Pascal
how be
Pascal question way I trigger me power the free teacher man said that by see my friend wants to marry but the fiancé has tested positive for hepatitis B. Should he call off the wedding?
Oh.
Now don't for me person worry. And Obama tested hepatitis B positive. And see obisa say our no omunja na.
Abribia yenya cases bebre etisa. Na eya eto omfo. It depend mo ankasa. Ye chewo options e wo ho. Option e wo ho ne so oba na benum na edro. Na wa achieve viral load suppression. Na wo be ma no so wawo panie no e de abo ho ban
ono woni bi no so de bi oba okay oba ko wo vaccine no okay
no de abo no ba na oba na wo bi no ono na no medro wo betimi atem ho asesa
na omo ware na omo
wo a enti na ye wo de be ya akwala no oba ni nya nyempe ye be prepare ne say on pay dra owo a
but psychologically minimum say oba no e wa hepatitis B a mini de kwakoda no
yeah educating no because unya antibodies na anti na make say mini o kra e bia we have been exposed.
Me exposed because
exposed nature say virus no aba system until o kra na real system no ma o system no would quickly because you've had the vaccine eliminated. There are some people who have not vaccinated but have been exposed before. Nti no it's in our environment whether we like it or not. Nti any say stigmatize nipa say ni say ntia. Nti panel, you know that you have antibodies ready. And also, some people have been coming to the clinic, check your viral load over years, undetectable nature say, but we still monitor them is because oja drone for a long time. A bit me a virus no. Say DNA So such a person with an undetectable viral load, and a panel no, there's almost zero chance that you get. And also because of the undetectable level, Obama so it's very unlikely that Obenya because it's the viral load that predicts say me Ediamo Obi.
But Richard, our real sorry investigations no more hepatitis B count. Thank God.
HIV
because
hepatitis B. genotypes.
Nina account. Okay. My last question we I said, doctor, my husband went for medical screening and he was told he has hepatitis B. We've been married for 5 years. Does it mean he has been unfaithful? Mrs. Hey, everybody know. I say, Nick call for medical screening. And you catch and say when you hepatitis B, I'm so testy and now hepatitis B. And so Obani and also married for 5 years near. And so Obani person bisa say and Nick Kuno she say I'm so bad and Obeka catch any no. Nam so no only be. And so bisa say Nick for the chiana. Question maybe to me as I don't say wow
it doesn't necessarily mean because as we said there are so many ways of getting it. And in Africa, in our setup, we have established that mother to child is one of the major ways of transfer. Mother to child. Nti ebia na ne mame edemano. And he never noticed until now. He could have also gotten it from maybe another for using a clippers and also or the channel. So yes, sexual contact can, but it plays a very minor role in transmission. Nti interesse wafawichi. It could be the other
factors.
Yes.
Dog, yeah, sorry to cry. If it's so Bernard Bamagana for this year, we are doing celebration.
This year, say
let's break it down.
And we are breaking it down. Today, we've actually broken it down.
They say, rumors and for material, yet to actually near the papa and mamma. We go on to that and bring any opportunity and say, about the way, or Betty, or bear awakening. Now for 2 and 1 more. The woman so far will be. But omo ni me yare kro nti omo de na hye dem e na omo ye no herbal medicine etempa no betimi aba empempi na ye sa awareness wi yenya nkofo e ba ya yare sabia bebre moti sam wo ka ho asem nti na me so me pese me ba check enu nti na amenti ye breaki bibia e barrier man nkofo enya access to the treatment, the testing, the medications in adena ye breaking down.
Okay.
And I feel yes, elimination right now. Everyone, everywhere.
Okay. Ghana Health Service, more particular events be on more year and
Yami Aduma, Yanim say, Yempeni for Bedi share by 28, on commemoration, Ministry of Health Conference Hall. Now, num to me. Or Chame Kwame, lead advocate. Abo ho deuru intino, obeba ho, aba beka ho asem ye wi a yategwa monten so aye ho dede kakra akọ
munya free screening
original all the original health directorates screening all district hospitals screening all the teaching hospitals ni na ye bia to say bia anya screening ni
general
free
okay but omo ba ebi first can show mu bottom
ubana
opania who say who nibia na was opania no start in them
and opania no so subsidized ne bona perform quarantine
so mu one
last year was I think 30 cities
the 30 yeah
still 30
yes.
Okay and see yeah free screening is free but what testing na we hepatitis nibia you be opania is over 1 to 3 times
no
abon who buy afebo we so be test ya e be hu so wo bi no e no be tu edro so pa twa edro na nya one time edro e so o de she wa adwem enya edro a fa no 2 weeks and edro a fa no 1 month edro na obe fa no because virus no wo mu na we say a brave virus na say so it's for the rest of your life
that's for hepatitis
hepatitis B no but see the there
3 months
and no dey e be clear ni nyina ma me boa okay enti ma clear ni nyina
na vaccine no wa obewo vaccine bia na be ma card krata na be di adanse say wa wo pane no de wo ba ko no
obetro date
bosumi na obema obiem no asacho na afi bosumi nsentem wo de sa card na aba empempia na e ha adwen obeye be no se me hu me card na afi nimpa no hu say ya mpasa wa wo
na wo
e be sa na wo kohye ma wo ba wo say san so screen no biem
na san start biem
na ya start biem eno na ye pese ya avoid nti say wo start pe hwe say obedi so saa bosumi nsia na according to okay fa na say bosumi nsia according to awo ye den wutu na we yi wonse fi na abo
me ne Ghana ban kranka meka say ansa na ebe ma obibi na so show hepatitis B card na eja wo bo ho ban na wo bo the whole Ghana ho ban because ni baba akonya yare na or to me spread them over 100 people me boy minim say it's less but that is it until bia and born ho ban no ko je card effect so our dia kita hepatitis B e bi tu kwan na mo go yellow card
tu kwan it is requirement say for card no bo ko akwaje yellow card no dia tu kwan ni na say wo ye ni na boa wo mo akasa wonya sa na ma no go ho na abon ho ban
obisa for me jama na mu dia seda kese pa ma Dr. Fatima Mohammed Oye physician specialist asanso ye gastroenterology fellow in training in the bonkomo and area we sounds na me that say pa e ma yenu abema Richard Peter Yale or a senior nursing officer public health West Municipal Health Directorate omumienu e na me ne omo bonkomo e fa hepatitis on kai say 28th of July a World Hepatitis Day me pacho wonya hwema wo body cry afia take advantage na kwa join them for the free screening on hepatitis me pacho across the whole Ghana me boa Ghana health service saying na all the public hospitals na omuye free screening uko na check it na wo bia me pacho enimanimu a na enu atu edro so o check na woni bia there yes here of vaccine a ye wa e bo ho ban afebo no de obetumi aye de obebia obetumi dwedwemu sa bra hepatitis wunye bi nti mpacho take advantage na kowo obodie nti yeda omwase mo hwe enso yeda mase mo amutie nyina nso yeda mase mo di questions no ba nyina nso yeda mase na mefa akonya we nso na mede aseda pa ama guy yenuanom omombeja yen eyie abra yesie Mrs. Reverend Grace Ado Reverend Mrs. Grace Ado ewo sem yeda umase nyame nsho bibia ebusiafo se omoda mase nti meje ebusiafo anemu nso na me de aseda kese pa anama mo me den de Abigail Ashley me kura me do mo ye ejuma nyina so me do mase dasene ye be hie biom bye bye
yeah me no doctor feeling my body. Tell a friend to tell a friend. Tell me the body and come up and a trapper. My health, oh my life, oh. Me inquiring my pomade, my health, oh my life, oh. My pomade, me my health, oh my life. Me inquiring my pomade, my health, oh my life. My pomade, me no doctor, feed them up. Tell a friend to tell a friend. Give me the body and come up and trap up, baby. Hey, Robert, I'm so sorry. Tintini won't come. Do you wanna learn more? And I get ready, cause it's all about you. My health, oh my life, oh. Me inquiring my pomade, my health, oh my life, oh. My pomade, me my health, oh my life. Me inquiring my pomade, my health, oh my life. My pomade, me it's all about you, family. On your TV. Me my pomade.